can you kind of go through all the different things that you did? Because it's interesting that you arrived at natural hormone balancing.
Right. Yeah. So I started practicing a little less than 50 years ago.
Okay.
And I was a general practitioner. They don't even have those anymore. Now they have family practitioners. That would be the family practice, or ER doctor. So I started off, I had a emergency room. I was in charge of it. I was probably, 25.
Really?
This young Doc Watts, They gave me a little black case when I got out of medical school, I'd carry that in with me, and nobody ever asked me to do a house call. I don't think, I think that was out of the, they weren't doing that at that time. But they were just starting to do ERs, and so I took over this little ER in Tarpon Springs. Great little community. Have you ever been up there? And oh my gosh, you should go.
Yeah.
Wonderful food. So, and little restaurants and the Greek area. They call it the Sponge Docks. You've heard of that, I'm sure. No, you haven't? Oh my gosh. Brian?
We're young. We haven't traveled the world.
Take you up there. Cute little community. It's a Greek community. Some of the people there at that time for sure did not even speak English. So
wow.
I got a real, into that culture, into the Greek culture, which was fun. And here I am coming into Tennessee boy. I was like not used to that type of culture. It's very dynamic and very expressive. And I'm like, what do I do? These Greeks are coming in, banging and throwing their head and doing all this screaming and hollering. And I'm not used to it,
Right.
And here I am trying to be stoic and be the guy that's in charge, and it was not easy learning all that. But I took over, had a family practice, my own practice there, and then I had a little nursing home there. So I had 10 years that I did that before going into OBGYN.
Wow.
I did OBGYN residency with the University of South Florida, and then started my practice here in Sarasota in 1980. And I delivered probably during that few years, probably let's say 20, about 7,000 babies.
That
is
is
a lot.
Insane.
I know,
that is insane.
Half a city.
I mean, you've watched life like that. To me, anytime we have people on here that are moms, or like, that's kind of one of the subjects for some reason I keep kind of gravitating towards, because it blows my mind that women have these, it's like a little life inside of you. They can feel it moving around. And then you are the one who's like ushering this baby into the world. What did that feel like?
It's just that smile on your face. It's that, and what those mothers are telling you, it's that, because it's a miracle. I don't know that any man can feel that.
Yeah.
I don't know that I got involved as close as I guess a man could get into delivering babies, but it was just miracle.
Yeah.
I mean, as much as you learn, as much science as you have about that, and there's lots, you don't get to the basis of it.
Right. I mean, after 7,000, did it ever get like, all right, here's another one? Or was it like every baby was just like, this is a new life? Did it feel?
It's everyone.
Yeah.
Everyone. I never did. Now, I remember my wife even reminded me, I got, every once in a while, let's just say you're doing a lot of babies. That's a lot, sometimes a month. So you're getting up a lot at night. You're staying in the hospital on the weekend. So a lot of that's dedication to do that. Well, you get tired. And I remember my wife going like, because I would get up like, let's say 2 o'clock in the morning, get ready to go in. I'm like, ooh, another baby. And my wife said, that is not a good attitude to have. This mother is having her baby, and you better get your, chutzpah up here.
Right. That's so cool. So 7,000 babies. And then what happened next?
Well, interestingly, the kids left. We had 2 children. They left home. Sherry says, I want you here more. So, I don't want you out on all the weekends. I don't want you out at night. I want to be you home, because it was just she and I at that point. So she kind of talked to me about the time to give that up. And I literally had a depression.
Really?
I'm not kidding. Yeah. I was going like, oh yeah, but this is who I am. This is part of me. So I actually had to go to a psychologist to talk, a friend of ours. And she was very good about helping me through this transition. But, she said, it's kind of like this, I see this old couch, I see this old chair in the room. She said, the chair is very comfortable and it's very cozy and you like it and it's your go-to, but it doesn't fit the room anymore. It's just not the right decor for the room anymore. So she had me have that analogy, and then she gave me a rose. I'm not kidding you. I don't know if you've ever seen some of my a nursing staff will bring a rose home and they'll just let it sit in a cup and it's dead. I mean, the rose is like that. It's all dried up. And she said, whenever you think about this, think of that. Think of this rose and how that helped me. I don't know. And then we took pictures of all the babies with her in my office. You can see them around the room. So they're little pictures of this, and we had a collage made.
So you can kind of keep that piece of you with you.
Kind of like keeping the dead rose and the pieces of babies and stuff like that. And thinking about the analogy of the old chair. Yeah. And that helped me. And then, of course, my brain's kind of going on. I'm trying to figure out, okay, so what's next? I went into GYN surgery. I more or less specialized in what they call minimally invasive surgery, which back then was laparoscopy. Okay. And you've heard of that, right?
I've heard minimally invasive.
Minimally invasive. Yeah. So what the goal was try to find the minimal surgery that could be done for a problem. Let's say at that time when I first started into surgery, GYN surgery, we were doing hysterectomies, was the most common one. Let's say that women would have the surgery, might last 2 hours, big incision, 5 to 7 days in the hospital, pretty high complication rate, maybe 2% complication rate, so infections or pain or this kind of thing, and long recovery, say 6 weeks recovery, 8 weeks recovery. So it was a real big undertaking to do this. We were able to switch that into about 30 to 40 minute surgeries through the belly button, outpatient. Like they would be out of the hospital in 2 hours.
What?
And
how long did it take to transition between?
Not long. We were amazed because we were starting to keep people just overnight.
Right.
And then we found that we didn't need to do that. So we would, I know. And the pain was almost nothing. They'd call me up and going like, hey, the next day, can I go drive my car? No, you can't drive your car. You can't go swimming or out running a marathon, but they would be just not having
fine
pain. Yeah. So you're going like, wow, so that was a big transition. And I got to see that. Then eventually, what happened, my practice started evolving into more aging. I took a big, long course. I took the certification course for American Academy of Anti-Aging Medicine. That took about like 4 years. And I took a large master's course in that as well at USF on metabolic endocrinology. I studied that. And then took another certification course in integrative medicine up at George Washington University. And that took another 4 years. So I've been at this a while.
Yeah.
I'm an old guy, So it's been wonderful. I've really enjoyed what I'm doing. I mean, I feel, we talk about the miracle. I feel like inspired.